You are listening to the Health and Wellness Podcast, curated by Dr. Lori Marzell. Dr. Marzell is a primary care physician that combines the wisdom of natural medicine with modern medicine to help facilitate the body's inherent ability to restore and maintain optimal health. She focuses on evidence-based nutritional therapy for food allergies and in bioidentical hormone replacement. She is a twice published author, a long-standing member of the North American Menopause Society, and a certified menopause practitioner. We are on a mission to empower you with the knowledge and expertise that Dr. Marzell has earned throughout her career. We hope you enjoy and want to thank you for being with us today. Without further ado, here's Dr. Marzell. Enjoy the show.
Hi, this is Dr. Marzell. Today I'd like to talk about chronic illness or persistent illness and food allergies. Food allergies can play a role in people who are chronically ill. How does this work? And how do you know if this may be related to your chronic illness? Well, let me give you some examples about things that may be caused by a food allergy. Okay, so any type of repeated infections. So let's take children with repeated ear infections. This is frequently caused by a food allergen. The child eats something that they're allergic to. The body reacts in an inflammatory manner. There is swelling around the eustachian tube from the ring of lymph tissue that resides right next to the eustachian tubes. Blockage occurs. This provides an environment that invites the growth of bacteria, and thus you have the resultant ear infection. Because people don't recognize what is the cause of this, they frequently eat the same foods again and again and again, causing chronic inflammation, chronic irritation, and an invitation for bacterial growth. Most children have a reaction, if of anything, to dairy products. And it's very interesting that people are frequently drawn to things that they are allergic to and cause them to be ill. Sometimes you have people eating something and they just feel horrible and they just don't eat it anymore. But frequently, the food allergen can actually stimulate the production of endorphins. So what this does is make them happy. And, I feel so good when I eat this food. Unfortunately, what happens is after they have eaten it, then down the line, maybe not immediately, but maybe in an hour, 2 hours, or something like that, they start noticing the results of eating something that they really should be avoiding. Let's talk about a few more health problems and how this may relate to what you're putting in your mouth every day. Let's talk about repeated urinary infections. Again, this can frequently be caused by a food allergen. Sometimes the reaction to the food allergen, it's an inflammatory reaction causing swelling and a bunch of antibodies being produced. This can be settle into an organ, like the bladder. So I'm frequently seen in women who have a propensity for repeated urinary infections. This could be a food reaction. As a matter of fact, there's actually a condition where eosinophils, the cell most that is prevalent in an allergic reaction, resides in the walls of the bladder. So it's very suspicious to me that this is most probably there is a component of food allergy in this condition. Any kind of eczema, let me talk about that. Eczema usually presents as a skin rash, red, scaly, uncomfortable, itchy. Oftentimes it is in the same exact place. If you put on a little cortisone cream, it suppresses the inflammatory reaction that is being present in that part of the skin. So the rash heals. Then when that wears off, the rash comes back. Same exact location. This is almost 100% food allergy reaction. The exception may be if you put your hands in a solution that you're sensitive to. Yeah, you will have a reaction to that. That's not what I'm talking about. I'm talking about people don't know what is causing this. They just have this breakout. They don't know what to do to get rid of it except put a cortisone cream or gel or something like that on. It goes away. They think, oh, good, it's gone. And then, lo and behold, when they stop putting the cream on, it returns. That is almost 100% food allergy reaction. Migraine headaches are very frequently associated with food reactions. Again, this is an inflammatory reaction. In the body, you have vasoconstriction, and that tugs on the membranes over the brain, causing irritation and inflammation, and thus the headache. Every patient that comes into my clinic that has a migraine headache problem, I always recommend food allergy testing, because the avoidance of a food allergy can totally resolve some of these conditions I'm talking about. This is without using drugs, just by simply changing your diet. And if something is causing this much of a reaction in your body, it's like a little flag. Your body's trying to wave this flag that something is wrong. Please help me. So it's time to look at what could be causing this, instead of just trying to suppress things by using cortisone creams or other suppressive drugs. Because food allergy reactions can settle into an organ, there have been cases where people presented with gallbladder pain, and it was caused by food. The patient had gallbladder surgery, and they didn't know it was caused by food. They kept eating the same way. The gallbladder pain, which wasn't really a gallbladder pain after all, persisted in the same location until they decided to test and eliminate foods they were sensitive to. Then the gallbladder pain went away. Very interesting. Irritable bowel syndrome, or SIBO, actually is related to an overgrowth of certain bacteria that can produce chemicals that can make patients constipated or have diarrhea. But the irritable bowel, where the body does not have an overgrowth of bacteria, but is just inflamed, irritated, having diarrhea all the time. I had one patient, I'd like to tell you about this case. It was a very interesting case. He was afraid to go anywhere because he had diarrhea frequently throughout the day. He was afraid to go to a ball game or pretty much do a movie. He had to keep getting up and running to the bathroom. It was a horrible lifestyle. And I found that he had allergies, and I suggested we test for food allergies. This patient was extremely motivated to do something to help out. Well, he was found, yes, he did have food allergies, so we took the food allergens away, rotated around the rest of his diet, and lo and behold, he stopped having diarrhea. Of course, we gave him other things to help heal his gut, but it's not ever going to heal if something is causing inflammation and the patient continues to be exposed to it. So if you have a chronic health problem and you're wondering why I keep having the same symptoms over and over and over again, consider that you may have a food reaction that can be possibly fixed by finding out what you are reacting to and avoiding it. Thank you for listening, and stay tuned for more exciting information.
Thank you so much for listening. If you enjoyed today's content, please feel free to share with a friend and help us spread our message. If you'd like to learn more about Dr. Marzell, please visit our website at www.drmarzell.com. Until next time.